Hi viewers, welcome back. In today's video, as a part of the continuation of the minor disorders of pregnancy, we are going to deal about the respiratory system and the integumentary system. Okay, so respiratory system respiratory system is a major system which is going to get affected with the physiological changes during pregnancy. So what is happening exactly? The body is able to cope up with the demands. Okay, so that is like the normal demands, it is able to cope up. Now pregnancy is a special occasion where the demand for the lungs is more. Okay, so the oxygenation has to be more, the respiratory rate has to be more, the circulation has to be improved. Okay, so the respiratory system or the lungs, they are going to work little more harder to perfuse the placenta, the perfuse the fetus and the other body organs. Okay, so that is the reason there is a complaint of breathlessness or dyspnea during pregnancy. So when there is a breathlessness or dyspnea, what we are supposed to do? Okay, so when there is a complaint of dyspnea, so we are supposed to give rest for the mother. Tell the mother to go in for a rest. She can either sit for few minutes or otherwise she can lie down with the left lateral position. So again I am concentrating on the left lateral position, that the perfusion has to be maintained to the placenta and the fetus. So the mother is going to have a left lateral position. So she can have a break. Okay, so rest has to be provided to the mother so that only the vital organs including the uterus is getting perfused and all other activities are coming down. So that, and then you have to provide fresh air to the mother. Okay, see to that the mother doesn't sit inside a room, she is not inside a room with AC, okay, or with a fan. Tell the mother to have a mild visit in the balcony so she can receive a fresh amount of oxygenated air, so that can improve the breathlessness or the dyspnea for the mother. And then you have to go in for evaluation. So this is, I am talking about a normal mother, like where there is a mild discomfort of dyspnea and breathlessness. So sometimes what happens, this is not common with all the mothers. Sometimes there is a respiratory decompensation, there is a circulatory failure, there is something which is related to some pathological condition, you have to rule out. So always, in case if the mother is complaining of frequent breathlessness and dyspnea, you have to rule out for anemia, rule out for cardiac, rule out for renal disorders. Renal in the sense like your respiratory disorders, like where the perfusion is not adequate. Okay, so you have to evaluate the mother for any complicated conditions. Okay, then comes the integumentary system. So integumentary system, the major complaint. So here we are not going to talk about the skin changes and all, like we are just going to talk about the complaint, that is the itching. Itching is going to be a major complaint during pregnancy because of the hormonal changes which is taking place in the mother. So where does this itching takes place? It can take place any area in the body, and particularly it is usually in the breast and in the abdomen of the mother. So when there is itching, like what we are supposed to do? Okay, so the first point is like you have to cut down the nails of the mother so that like when she is scratching, it is not going to harm or it is not going to peel the skin of the mother. Okay, so tell the mother like cut short with the nails. Then we have soaps. Soaps is like you have to tell the mother to avoid using soaps, or otherwise she can use a mild soap or a shampoo to take bath so that it doesn't irritate the skin too much. And you can go in for local application. Okay, you can go in for calamine lotions, like that may decrease the itching. Sometimes it is your coconut oil, so decrease the itching of the mother. Okay, so anything can be tried. So it is all like trials you have to do. Sometimes it will come down naturally. And then we have vaginal itching. Okay, so when does this vaginal itching is present? So sometimes when you rule out there is severe itching in the vaginal region, it may be because of the diabetes. So sometimes because of the glycosuria, she is having an itching. Okay, so you have to rule out whether the mother is having diabetes. Okay, and then comes the local applications, like you have to, that's what I said, like calamine lotion in case it is over the skin, and in case if it is in the perineal region, you have to go in for perineal ointments. Okay, then comes the antihistamine. So generally you can go in with your Avil or cetirizine. So these drugs, like, it can come down, but always with the consultation of your obstetricians. Okay, so then immediate action needed in some conditions. Okay, so what is this immediate action which is going to play a major role? Okay, so some conditions you may think it is all a minor condition. So in case if it is, so sometimes you get confused with your minor disorders and the complicated areas. So I'm going to tell you, like, in which areas you have to concentrate and you have to seek immediate hospital aid. Okay, so severe gastric pain, sometimes, like, we have learned about the heartburn and the acidity. So in case if this heartburn is going to get resolved with whatever your fluids, your hot drinks, and like your positioning, all those things you have applied, nothing is going to work out and this pain is going to become severe. So immediately you have to take medical attention. Okay, so sometimes it may be because of a cardiac complication. Okay, so you have to go. And then premature contraction. So always we talk about this premature or Braxton Hicks contractions, so which is going to get relieved with your home remedies, but sometimes it may proceed and it may cause premature delivery also. Okay, so whenever there is a premature contractions, like, you have to seek hospital admission. And then rupture of membrane. So we were talking about this incontinence of urine and vaginal discharge. There is something extra also, rupturing of membrane. Sometimes you don't know that your dress is getting wet. It may be because of incontinence, sometimes it is because of the vaginal discharge, sometimes it is because of the rupture of membrane. So you have to be careful when it is a rupture of membrane. It may initiate the labor process. Okay, so you have to go to hospital immediately. And then comes sudden swelling or edema. So we have already seen there is ankle edema, there is mild edema all over the face, generalized edema, which is going to be present in pregnancy. But when it is going to happen suddenly, it indicates there is something abnormal with the mother, whether there is some problem with the hypertension or otherwise some renal complications, some circulatory disorders, something is happening abnormal to the mother. So you have to be very careful. And then comes the frontal headache. Again, frontal headache or the bouncing headache. Okay, so you will be having a severe frontal headache or frontal pain, which is going to be very severe, which can indicate the mother is becoming pre-eclamptic or eclamptic phase is going to happen immediately. So you have to be very careful. So you have to seek hospital attention immediately. And then comes decreased fetal movements. You have to keep on observing for the fetal movements. Okay, so I always say you have to be analyzing the fetal movement. So every now and then you have to talk with the baby, you have to tell the baby what you are doing, like you have to play with the baby, singing songs and all those things you have to do. So when you are doing something, the baby responds to your, like whatever you do, the baby will have some response. In case if you are able to feel that the baby is not moving, when there is a decreased fetal movement, immediately you have to seek hospital attention. And then coming to vaginal bleeding. Bleeding is different and the vaginal discharge is different. Okay, so you have to differentiate. Okay, so vaginal bleeding, when there is an episode of bleeding, it must have an idea that you are proceeding into labor. Okay, so in case if a bleeding is taking place before the labor period, okay, so either it can be an abortion, premature delivery, so anything can happen. So you have to be very careful. When there is an vaginal bleeding, you have to report to the hospital immediately. So the areas where you need extra precaution is severe epigastric pain, premature contractions, rupture of membranes, that is like premature rupture of membranes, and sudden swelling or edema which is present, and then frontal headaches, decreased fetal movements and vaginal bleeding. So in case of any of these things occur, you have to seek medical attention immediately. Okay, so with this we are completing the the minor ailments or the minor disorders during pregnancy, where we have discussed the areas of the GI system, respiratory system, your nervous system, musculoskeletal system, genitourinary system, integumentary system, all the areas we have discussed. Okay, so if you want, you have to go back and see for the other videos also. Okay, so hope you understood the class. If you have any doubts, you can go and ask me in the comment box. Okay, take care, bye.